As the temperature climbs, so does the number of people heading to hospitals with heat-related illness.
So we definitely have been seeing a number of patients coming in with everything from, heat cramps, upwards of heat exhaustion. I have not had a heat stroke patient yet, but that's definitely the more dangerous end of the spectrum.
Dr. Omiyemi Adebayo is an emergency room physician at University of Maryland, Baltimore, Washington Medical Center. He says there are 3 grades in heat-related illness. First is heat cramps, when muscles cramp up. This often happens to people exercising and not hydrating enough. Next is heat exhaustion.
Headaches, nausea, sometimes vomiting. Typically, patients will be kind of cool, clammy, and this is a result of the body's inability to properly cool itself.
Finally, heat stroke, which is life-threatening.
Red hot skin, very dry skin. Your heart rate will usually be very elevated. And one of the defining pieces of that is that your core temperature actually is above 105 degrees Fahrenheit. And so as you can imagine, with your core temperature being that high, it leads to a number of issues, brain dysfunction, people can have seizures, and ultimately result in coma or death as a result of that.
The very young, less than 4 or 5, and the old, more than 60 or 65, are most vulnerable, especially those who live in urban environments where concrete and asphalt create higher temperatures. Dr. Adebayo says if you do plan on being outside for work or exercise, stay ahead of things by drinking 2 to 4 8-ounce glasses of water every 1 to 2 hours. If you're starting to feel symptoms of heat exhaustion, get out of the sun, seek air conditioning immediately, and hydrate. Water is preferable, but other liquids will do. However, you want to avoid caffeine, and of course, you don't want to drink any alcohol. If you witness someone having what appears to be heat stroke, you need to cool their body down right away. If you can, place ice in their armpits and their groin area. If they're conscious, try to get them to drink something. And of course, call 911 because this is a true medical emergency.
It could save their life.
It could, absolutely.
Yeah.
Yeah.